My son Daniel Lorona Sams, he has chronic lung disease, and he was at the hospital like every 2 months admitted for 3 or 4 weeks at a time with heavy antibiotics. And then we met Dr. Shahezi, put him in a treatment. We started in prophylactic antibiotics. We followed the treatment, and now Daniel gets admitted at the hospital maybe sometimes once a year or not at all during the year. So the improvement to come in this clinic and have under the treatment and supervision of Dr. Shahezi has been very helpful to my son. First of all, avoiding the trauma of ER and admission, and also to the family, economically, emotionally, and all the way. Thank you. Hi, my son is Daniel Lorona Sams, and I'm very grateful to this facility personnel, very kind on the phone, answering the phone, and also the prompt response of getting things together for my son, including the pharmacy. Sometimes some medications are very difficult for the insurance to approve, but they take care of the paperwork necessary back and forth with the doctor, and I don't have to have like those headaches or frustration not getting the medicine on time for my son. And also the equipment here that Dr. Shahezi has in this clinic is very beneficial for my son in getting the accurate diagnosis for the right medicine along. I'm very happy with this facility. Thank you. Hello, I'm the mom of Daniel Lorona Sams. My son is going to be 20 years old. He has a tracheostomy tube since he was 2 months old. And the first time that I met Dr. Shahezi, he asked me, why does he still has a trach? I was impacted for that question. I didn't know what he meant. I thought that I never, no doctor asked me that question. And I said, why are you asking me that? He said, well, because by now, with treatment, I can see Daniel is a candidate to have the tracheostomy tube out. We were very excited. We had in a program. He followed my son very closely through 2 years. We heard him for the first time making noises with the speaking mirror valve and also total valve. It was very beneficial. When we reached the point of removing the trach, Daniel had an accident with one of his nurses. So that's why he still had the tracheostomy tube. I was very excited, and my son is breathing overall better since we are in a treatment with Dr. Shahezi. Thank you, Dr. Shahezi.
Daniel Lorona is a special case of cerebral palsy with a mosaic form of Down syndrome, and he has actually pancreatitis as well. And what is actually causing the problem most of the time for him was that he has this tracheostomy because of upper airway resistance and obstruction. He had it at one time, and when I saw him, he had a lot of frequent hospitalizations because of the aspiration pneumonia, and I started him on prophylactic antibiotic. And mom is a very dedicated mom, and we are working together. And mom, each time that he is getting the first symptom of any problems, like a cough or increased secretions or something, she calls me, and then I started the antibiotic or giving him something that he needs, and I put him on intrapulmonary percussive device as well as frequent nebulizations and the CPAP and BiPAP as well. And he responded well, and now actually he's not going to hospital, and the frequency of hospitalization is much less now. Is maybe once a year, and it actually the last time it happened was more than a year ago. So he's very stable, and as I said, we are decreasing actually the cost to the health services.
My son, as I said before, has a chronic lung disease. He with frequent wheezing and bronchi in his bilateral lungs, and now he's more stable. We don't go to the admission or the ER and the hospital too often. He's happy, as you can see, and the energy of breathing takes a lot. Now he's getting weight. It has been really beneficial being under the treatment under social health.